So what exactly causes erectile dysfunction? Erectile dysfunction can occur due to either or both of two reasons: physiological and psychological reasons. So most of the time it is due to psychological reasons, due to thoughts or feelings or stress. It is called psychological impotence. Now, common physiological or physical causes of impotence are diseases of the heart and blood vessels, kidney disease, chronic alcoholism, diabetes, nerve problems, say from surgery, injury, low amounts of blood hormones, drug side effects, and so on. Having erections at night or when asleep usually mean that your physical sexual organs are working well. Usually, this means that your mind and psychological issues are not so much in play while you are sleeping. This also points to the fact that the erectile dysfunction is more of a psychological cause than a physical one. So it is normal for a man to have 5 to 6 erections during sleep. Absence of these erections may mean there is problem with nerve function or blood supply in the penis. However, many men who have no sexual problems still do not have regular night erections. So don't worry too much about this. In younger men, problems with erections are more often than not psychological than physiological or physical. So wait, we will be looking at more practical causes of erectile dysfunction. Psychological causes of erectile dysfunctions. Psychological causes like anxiety, stress, depression, poor self-image, mental disorders, and so on. And usually it gets worse due to performance anxiety or anticipatory anxiety. This is when the fear or expectation of a possible failure causes an actual failure of erection. So if you start worrying about your erection, usually that worry in itself is enough to prevent you from having an erection. So that's an example of a psychological cause of erectile dysfunction. And the more you worry about having an erection and the possibility of failing to have an erection, the more likely that you will fail the next time you try to have an erection. So many men, because of one single failed erection, have suffered for several years due to the vicious cycle of performance anxiety or anticipatory anxiety. Also closely related to these is stress. Stress is the biggest erection killer. If you can't identify any major stress points such as a new job or an unexpected dip in your emergency fund, take a look at your relationship. According to a 2006 study published in the Journal of Nervous and Mental Disease, internal stress, that stress that originates from within a couple, is more likely to impede your sexual life than external stress outside your relationship. So take a close look at your relationship and stress emanating from your relationship that may be the cause of your erectile dysfunction. Moving on, aging. Erectile dysfunction is 4 times more common in men who are in their 60s than those in their 40s. So generally, as you get older, your erections begin to get weaker and weaker, and you may need more and more stimulation to get an erection. Also, low testosterone levels. If it's not just your erections that are taking a nosedive, but also your libido or sex drive, you might want to have a doctor check on how your testosterone levels are doing. Low testosterone is more common than you might think, and it can be a result of aging, not sleeping enough, poor food choices, and weight gain. So there are plenty of natural ways to boost your testosterone, but the first step is to get some blood work done so you can work out a plan with your doctor. So if natural ways of boosting your testosterone are not working, medications may be prescribed. Moving on, smoking. Smoking is a key cause of erectile dysfunction, and smoking causes erectile dysfunction by narrowing the blood vessels. Also, alcohol. Alcohol is a central nervous system depressant, which means it slows down everything, including blood flow to your penis. A 2007 study published in the Indian Journal of Psychiatry found that heavy drinking increases the risk of sexual dysfunction, including premature ejaculation, low sexual desire, erectile dysfunction, and the researchers studied 100 men with alcohol dependence and found 72 of them experienced one or more type of erectile dysfunction. Pornography use. Some scientific studies and articles maintain that addictive use of pornography, especially when it is accompanied with masturbation, can cause erectile dysfunction, what is known as PIED, pornography-induced erectile dysfunction. Medications may cause sexual side effects, including the loss of sexual desire, inability to ejaculate, and difficulty reaching orgasm. A 2012 study published in the Journal of Sexual Medicine suggests sexual side effects of some hair loss medication could persist for years. So what is in your medicine cabinet could be affecting your erections. Other drugs to look at apart from hair loss medications include drugs that lower blood pressure, antidepressants, and muscle relaxants. Moving on with the common causes of erectile dysfunctions. Disorders of nerves and blood vessels. Diseases like diabetes mellitus and multiple sclerosis can cause issues with the blood flow and the nerve function, and this could cause erectile dysfunction. Disorders affecting the physical structure of the penis, e.g. Peyronie's disease, causing the bending of the penis, can affect erection. Surgery may remove physical structures that are necessary for erection, and surgery could also damage nerves and impair blood supply. So this could lead to erectile dysfunction. Erectile dysfunction can also be associated with bicycling due to the damage and compression of both nerves and blood vessels. Obesity. Fat contains an enzyme called aromatase, which converts testosterone to estrogen. That's not good. Obesity is another all too common reason for erectile dysfunction in younger men. It is not just being fat that hurts your erection. It is the side effects from obesity, like hormonal imbalance. Fat produces estrogen, and then things like diabetes, high blood pressure, and heart disease. So there are several common causes of erectile dysfunction, and we have taken a look at them. In the next video, we will go dive into solutions. We'll start looking at treatment options for erectile dysfunction. Take charge of your sex life.